Hey guys, Dr. Adil here. Today we're going to be treating professional bodybuilder Regan Grimes. We're going to be treating him for a full thickness pectoralis major tear. We're going to be using our patented CytoRich platelet-rich plasma, which will be explaining how it works and step by step. And we've treated him before for a knee injury with the same plasma and he had a great result. So today should go smoothly as well, and we'll be sharing everything with you along the way.
So I used to do that.
I actually might be a big time in Call of Duty. All that stuff.
Yeah. So I was.
Were you gamer at all? Were you?
Yeah. No, I was like.
Yeah.
I mean, I was. I think.
Through school and whatnot.
Yeah. Well, I was actually #1 in the world for Halo.
No way.
Yeah. Like this was before. So this was before video games were actually really popular.
Wow.
And
I ripped Halo. I loved that. And it wasn't one of the world, but I loved it.
But back then, I wasn't that competitive. So like the top prize was like a couple thousand. The biggest tournament was like 50,000.
Wow.
But like now it's like millions.
It's insane.
It's insane. It's another
insane.
level. Like the top people get like multi-million.
They're
And
like,
the Twitch guys.
the Twitch guys,
30 million
they're making way more than like a lot of guys in sports.
Oh, way more.
It's like its own sport.
Yeah. And it's only at the beginning. In 10 years, sports will be like, it's crazy. But it's funny because actually the hand-eye coordination I have from that translated
right over.
So
that's pretty cool.
It worked out really well. It's like the perfect job for me. Yeah. It's like playing a video game. Like
but you also, you use what is it, the X-ray?
Yeah, exactly.
You see, because a lot of people that do these PRP shots, they don't actually look while they're doing it.
Exactly. Yeah.
So you're having a look and so
yeah, that's a big difference. Right?
Seriously, well, you know where you're putting it. Yeah.
And then also having good tech, right? We have so Luciano's really good in our other tech. Yeah. We look the best techs in Canada. So
how many? How much are we putting in today?
Like just like 5 or 6 cc's, not that much. But we're gonna put that gel to hold the PRP in place. Because remember it's like a full thickness tear.
Yeah.
So we want because or else the PRP will just go straight through.
Right. Okay.
Yeah.
Sweet.
All right.
So for anyone who doesn't know, we actually get plasma from the blood. So that's why we're taking his blood draw and then we put it in vials and we spin it in a centrifuge. And when we spin it, we separate out the plasma layer from the red blood cell and the white blood cell layers. And that's what contains the platelets, hence the name platelet-rich plasma.
Ooh, that's a thick mask.
When did you get back from the Olympia?
So after Olympia, I actually had a bit of a tour. So I did the Olympia, then the Reno, Nevada show. Then I was in Dubai for an expo for 3 days. Same weekend, flew to Egypt for the Egypt Pro. That's where I got the win and qualification for 2022, Mr. Olympia. And then the week later, went competed in Czech Republic, and I got 3rd there. And that's where we shut it down. I just got back on Sunday. So today is Friday.
No.
Or is it?
Yeah.
Yeah, Friday. All day today is Friday. And I know, I actually almost tripped out there too. The week's gone by really fast. It's been nice being back, visiting with tons of family and whatnot. But Dr. Khan's got me in here set up and taking care of something that we found, I think a few weeks out from the preparation, contest prep leading into Olympia. But at the time, it wasn't the right time to do it. So now, we're back. We're now in the rebound phase of bodybuilding, and this is the time where we check up on everything. Do our blood work, we do take care of stuff like this. So we have a small tear in the chest, and we're using PRP, and I don't actually know the full what we're doing, but the doc's going to tell you. So I'm here and in good hands, so I'm happy, man, and thank you.
So you've done PRP and stuff like that?
Yeah, I've done one before my knee actually. So, yeah, and it's helped. I have no knee pain.
When did you do that?
I want to say about a year and a half ago. Yeah.
You prefer doing PRP obviously over surgeries and stuff like that.
Yeah.
Other invasive treatments, they take a long time to heal.
Yeah. So these, within like 2 to 3 weeks, you can go back to training pretty much completely normal. You want to be careful, but I've seen great results with getting it done on my knees. I have no knee pain anymore, and I suffered a lot of with knee pain. Now, also, you need to coordinate your training and make sure that you're also training properly and not putting strain on the muscle improperly. But
awesome.
Yeah, Adil's we've been friends, and I've been working with him for years now, actually. So maybe five years. He's been taking care of me, so I'm very lucky and blessed to have him.
A little bit of a bruise.
Little bruise, okay, yeah.
So that's the only thing.
Okay.
It's not enough amount of blood that will make you feel like weak or lightheaded or anything.
Okay.
Just make sure you have something to eat in
Drink
between.
lots of water.
Drink lots of water. Okay. So I'll keep this safe till you come back for it.
Oh, thank you.
And we will see you at 4 o'clock.
Perfect. Thank you.
Okay, so all platelet-rich plasma is not the same. So there's different types of platelet-rich plasma, and the most important thing you guys need to know is if the doctor that's doing it is doing it properly. So how do you know that? So the first thing is if the doctor or the clinic is actually measuring their platelets. So for example, we have a scientist who measures our platelet counts, and so we know exactly what we're injecting. And we're the only clinic in Canada that does this. And there's only really a few across North America that actually do this, and unfortunately, there's not a lot of regulation in the space, so the standardization is still lacking. And so it's really important to make sure if you do get it done, you have it done by a qualified person who's measuring their platelets and has different types of platelet-rich plasma formulations to target different issues. So for example, today we're going to be using what's called CytoRich platelet-rich plasma. And the reason for that is that it has a more anti-inflammatory effect and therefore works better for chronic tears, chronic tendinosis, and arthritis. In addition to that, what we're doing today is we're actually mixing that with a scaffold, what's called SportsVis, which is a viscosupplementation, which is essentially hyaluronic acid or collagen, which essentially acts like a scaffold to hold the platelet-rich plasma in place. And the reason for that is because Reagan actually has a full thickness tear, which means the fibers have completely separated. And so the plasma will just go straight through, and so you need something to hold it together. So think of it like a glue to hold the plasma in place. So we're going to inject the gel first, and then we're going to seed it with the plasma to hold it in the pec tear. If you're going to get platelet-rich plasma done, make sure it's being done by a doctor who specializes in this area. There's lots of doctors who do it, but they only may do it a few times per week or do it here and there, but their main practice is surgery or their main practice is pain or something else. So in terms of how to actually do it, what we do is we take the blood, we put it in a centrifuge, and we spin it. Now that sounds simple, but spinning it can modify the platelets in different ways. And so we use different frequencies and different RPM, and depending on that, it can modify the composition of the plasma and the effect that it'll have in the body. And the only way to know that is to measure what's called the cytokine profile. So you need to measure how many anabolic or growth factors there are and how many anti-inflammatory cytokines. And there's also pro-inflammatory or pro-catabolic messengers in there as well. And so you need to measure all these to know exactly what you're injecting. And the reason we use what's called CytoRich is because we've measured the cytokine profile and we know that this is much more anti-inflammatory than the regular platelet-rich plasma. And that's not just us guessing, that's based off science and based off published peer-reviewed data. So once we spin it, we have the plasma separated from the rest of the blood, and we can isolate this into syringes and we can now inject it. And so injecting is actually very important because there's a lot of technical aspects to this as well. What that means is you don't want to just inject haphazardly into a spot by feeling it. You actually want to use precise image guidance. So whenever we do all of our injections, we use X-ray or ultrasound guidance so we know exactly where we're going. Whether we're targeting a muscle tear or a nerve, we want to know exactly this precise target. So precision is very key. So as you'll see in this case, we use ultrasound guidance to target the tear and fill it in using the plasma and the scaffold. Once injected, it will repair the tear, and so the result will actually be a permanent resolution of his symptoms. In other cases, such as osteoarthritis, the results can last between 1 to 2 years. As you can't cure arthritis, you can reduce the inflammation and manage the pain. Yeah, I was just saying, because he has so much muscle, it's hard to find these type of tears. So we actually, the MRI showed it, but even MRIs miss it sometimes. And then to get into it, you need like a really high resolution ultrasound. And then you also need a really good tech to find the spot, right? If you don't inject the right spot, it's not going to heal. And so it's very precise, and that's what we scan it very slowly and make sure we have the exact spot.
A certain way.
Yeah, he might get you to move it. Sometimes we make, I don't know, do you want it above his head or?
It's good for now.
Good, okay.
Yeah.
So what we're gonna do is, we're gonna inject the scaffold first.
Yeah.
And then we're gonna put this, we're gonna seed it with this. So it's a 2-step process. And you'll see, I'll put the syringe in with this and then I'll switch it to this one.
That one? No, the one you put here.
That should be good.
No one here.
Yeah. Okay. So we got the needle right into the tear. Now we're going to put the gel.
See it?
It's pull open there.
Yeah, I see it open up. Okay, and then
That's so
switch this. And we seed it with the platelet-rich plasma now.
This is where you get a bit of pressure.
Yeah.
How many mils?
Inject
Or
about
cc's?
6 to 7,
Ooh, okay.
just because
Yeah,
it's a, like
a
I
good
said, it's bigger
amount.
than it looks.
yeah.
But it's like all filled up.
Yeah.
That's pretty much it, right? It's all filled in.
So I think it's overlapping.
Yeah, okay, good.
All right.
All right, I didn't miss.
You guys
All those years of video
You're
games.
the best, man.
No.
Thanks, brother.
Yeah, no worries.
Oh, it's amazing. So
Well, it's
lucky,
cool. You can
so
see it
lucky
actually
to
open
have
up.
this here. You
Yeah,
know,
no.
seriously, like, what would you do? What would I do?
Well,
I'd
that's
be
why people
screwed,
around
man.
the world fly down here to come here. Yeah.
So, yeah.
All right, guys. So we just did the injection for his full thickness tear. We used the scaffold with the gel, hyaluronic acid, and then we seeded it with the platelet-rich plasma. Everything went well. How do you feel?
Feel great, yeah. I mean, like, just as the injection is going in, you feel a little bit of pressure, but nothing serious and nothing that was, I mean, it's not like you used any freezing or anything like that.
Yeah.
It was just right in and felt fine.
Yeah, we
Yeah.
don't use freezing because you don't want it to interfere with the platelets,
Right.
but still not too bad, right?
No, not at all. Not
Yeah.
bad at all. No.
Yeah.
And when you can expect to be back in the gym pretty much. And
Yeah. And then, yeah, so we're going to get you to go back to training pecs in 2 weeks, but he's
2
still going to
weeks.
be able to train everything else around that.
Yeah.
So it's not going to cause any atrophy or anything. And
Yes.
technically, you could still train the other side too if you
Yeah.
really wanted.
Right, okay, that's
Yeah.
cool. And it's perfect timing for me. I mean, coming off and, not having to, go too crazy, just finishing my shows, this is the perfect time to take advantage
Exactly,
of
yeah.
something like this.
Yeah, yeah.
You know,
We have a
so-
lot of off-season athletes, like NHL guys too, come
Yeah.
during the summer and stuff. So
Right,
that
yeah.
they all get it done.
Yeah, it's
Everyone
perfect,
needs it.
yeah.
Trust me.
Yeah.
Yeah. So then, yeah, we'll do a follow-up in like
Okay.
6 weeks, so we can
Okay.
recheck the tear, make sure it's all healed,
Yeah.
and then obviously you can go back to full strength training and everything,
Right.
and then you can do whatever you want, and hopefully it's all about prevention after that.
Good to go. Yeah, sweet. Awesome, man. Thank you
All
so
right,
much.
cool. Yeah, no problem.
That was great.
Yeah.
All right, guys, if you enjoyed that video, guys, please hit the subscribe button. Drop a comment below and a like. It would be much appreciated. Helps the algorithm and other people see this video. So, guys, hope you enjoyed it. Great time. We're going to have this nice and recovered. See you next time.